Anytime somebody has sensitivity, they typically will go to the worst thing. Do I have an infection? Do I have a cavity? Is my tooth breaking or cracked? One of the things that we go through when we're going through our look and understand sections of our exam would be, do you have pain? On a scale of 1 to 10, with 10 being the worst, where is that pain? And then we also talk about how long does that pain or sensitivity last after you remove the stimulus. So if cold water causes it to get really sensitive, when you stop drinking that water, how quickly? Most of the time, it's seconds. It's 20 seconds. It's 10 seconds. And so based on the level of discomfort and how quickly it goes away, that's how we kind of determine whether it's sensitivity. One of the things that I think is unique about the mouth is that it's its own ecosystem. It has its own biology. There's saliva. There are acidic things that we eat. There are basic things that we eat. And all these things come into play to cause different problems. When we talked about decay at another time, we talked about sugars and acids that come into play in the teeth that cause decay. There are bacteria that live in our mouth that cause periodontal disease and make the mouth more susceptible to decay. And so when we kind of look at that mouth environment as its own little culture, bioculture, we can maybe understand a little better why things happen. So back to the sensitive teeth. Sensitive teeth can be alarmed for many things in what we do, many things within our mouths, from the standpoint of decay, infection, but sometimes it's plain, simple, sensitive teeth. There are millions of little tiny microscopic tubules that go from the outer portion of the tooth and go right into the nerve. Most of the time, those tubules are plugged, but when they open up, it can be painful. I can remember preaching this to my patients for years and then remembering the first time I had a sensitive tooth, and I went, wow, that's real. And it could be scary if you've never had anything like that before. Everybody's mouth is different. We talked before about pregnancy. The acidic basic balance changes during pregnancy, and I think it's because of all the hormones and changes in their bodies that make small changes on the environment of the mouth. Sensitivity, tooth sensitivity is difficult to pinpoint on certain things, but when we talk with patients about toning down the sensitivity, we think about maybe more acidic things than anything else, because maybe that's what causes the little tiny salt that forms that plugs up those tubules. Bleaching or tooth whitening is one of them. Not that that's necessarily real acidic, but it is a little harsh and it can go in and open up those tubules. So everything we're trying to do, again, is to close them back. It's very difficult to be able to look at a patient and go, they're going to have a lot of sensitivity. The one patient you think is going to have a lot of sensitivity, they may be somebody that is just immune to that kind of stuff. And so their diet predicts it differently. So really, that's kind of a hard thing to pinpoint. We just need to be prepared to help patients get through it. When you have sensitive teeth, I still feel like you should get checked out by a dentist, because it's a sign of many other things that can happen. But if it's simply root sensitivity, dental sensitivity, which you'll sometimes read it about, that's something we can help you with very easily by doing something as simple as changing your toothpaste. The good thing about sensitivity is there are a lot of good products out there that help a lot with it. And it's usually not a metabolic condition or a dental condition that requires treatment other than trying to stop the sensitivity. It's just the normal life of what we have to deal with, I guess, as humans.